So we completed balanced diet. So today we are going to talk about nutritional deficiency disorders. Nutritional deficiency disorders. Okay. We will discuss protein energy malabsorption. Okay. And what are the symptoms? And we have diseases like Kawasaki, Orcor, and marasmus. Okay. Malnutrition, severe acute malnutrition, and childhood obesity, because these are the vitamin deficiency disorders. Okay, everything we'll discuss in detail. Vitamin B deficiency disorders, because it's very important. C deficiency disorders and D deficiency disorders, iron deficiency disorders. Okay, all this iodine deficiency disorders, calcium deficiency disorders. So all this we will discuss in this class. First, we will discuss protein energy malabsorption. Protein energy malabsorption means lack of protein content in the body, which leads to lack of energy. Lack of energy. Okay. Not only protein as well as macro and micronutrients. It can occur suddenly or gradually. Sometimes it is mild deficiency. Sometimes it is moderate deficiency. Sometimes it is severe deficiency. Okay. So whoever doesn't take proper nutrition or mostly protein food, protein diet, they have protein energy malabsorption. So what will happen? The mostly this nutritional deficiency will occur under the age of 5 years. Okay, under the age of 5 year. What are the causes? Causes is decreased deficiency of intake of proper diet, or taking of poor diet, infectious any infection, okay, or poverty, and sometimes lack of education, unknowing of eating substance, eating the diet. Okay, so due to the deficiency of uh, protein energy malabsorption, we have two to three types of deficiency will occur. Mostly we have marasmus. One type of disease is marasmus, and second one is Cavashiorkor. This is the Cavashiorkor. And third one is marasmic Cavashiorkor. Both are included. In the marasmus, what will happen? It is a chronic, severe calorie deficiency. Severe calorie deficiency. Chronic. In the Cavashiorkor, mostly due to the deficiency of protein, there is edema, fatty liver, and change of the skin will seen. Okay, and marasmic cavascularoma both will have both combined diseases will also occur. Okay, what are the sign and symptoms of this deficiency? The signs are weight loss, edema, and muscle wasting, and skin changes and hair changes and fatigue and weakness. So these are the weight loss. very severe high weight loss, body weight will reduce, and have edema accumulation of fluid under the skin, mostly in the leg and face, loss of muscle. The skin, you can see dryness, thick, and EDZ, you can pluckable the skin. Okay, hair changes, brittle hair, hair fall, you can see, and have lack of energy, unable to do any physical work. Okay, so we will talk the difference between Kawashikor and marasmus. So I will tell you that, not I will write here. Okay, Kawashikor means it will develop due to the deficiency of protein. Marasmus, both are deficiency of protein and calories. And Kawashikor, it will occur in 6 months to 3 years of age. Okay, marasmus, it is common in 1 year child. Okay, Kawashikor, edema is present, or edema is absent in marasmus. Fatty liver in Kawashikor. In fatty liver, no fatty liver in marasmus. Ribs are not very prominent. Ribs become very prominent. Lethargic. Here in the marasmus, the patient is alert but irritable. Muscle wasting, you can see that. Okay, in the Kawashikor, mild muscle waste. Muscle loss is mild. In marasmus, muscle loss is very severe. Poor appetite, and have loss of loss lot of appetite, unable to get the food. The person suffering from Kawashiko needs adequate amount of proteins. Okay, protein is main ingredient here. The person suffering from marasmus need adequate amount of protein, fat, and carbohydrates both. Okay, so these are the important things regarding the Kawashikoro and marasmus. So what you have to do? You have to, what type of management you have to take, because these are the diseased, it will convert it into diseased form. You need medical treatment also. Medical treatment. Next, you have nutritional rehabilitation. You have to give the nutritional proteins according to his recommended diet of that disease. You have to advise according to the disease. The nutritional, nutritional and therapeutic diet, feeding, and monitoring, and you have to support that. Okay, these are the things you have to remember. And another common disease that you can see, that childhood obesity. It is also a nutritional deficiency disease. Childhood obesity. Childhood obesity. Childhood obesity. Obesity are the sign of excess body weight. Excess body weight. Okay. And poor eating habits, due to the poor eating habits, lack of physical activity. Okay. And psychosocial issues. These are the signs and symptoms of that patient. So what you have to do, you have to encourage a diet, balanced diet. Okay, and you have to advise for proper physical functioning, and need to improve his psychosocial issues. And you have to educate that family members or the child, okay, and need to improve his socio psychological responsibilities. So for that you have to educate that person. So basically, first thing, according to us, dietary assessment, to advise for the uh, balancing diet of protein, fat, minerals, vitamins, etc., etc., which can improve this condition. Okay, if needs, medical treatment also required, therapeutic treatment also required to treat that condition. Okay, if it is medically uh, it is involved, medical involvement is there, so you need to treat that condition. Okay, if it is nutritional deficiency, you can easily manage, like, along with nutritional assessment, all the balanced diet, you can advise the patient. Now we'll go through that uh, deficiency of vitamins. First, we will talk about vitamin A deficiency. Vitamin A deficiency. What are the diseases occurs? One is night blindness. Night blindness. Second one is Bittot's spots. Okay. Third disease occur due to the deficiency of vitamin A, that is zero xerophthalmia. Xerophthalmia. Fourth one is keratomalacia. These are the common diseases are occurs due to the deficiency of vitamin A. Or all are like vitamin A deficiency here. Okay. Here also vitamin A deficiency. In the xerophthalmia, it is also vitamin A deficiency. It is also vitamin A deficiency. If prolonged vitamin A deficiency occurs, mostly xerophthalmia and keratomalacia occurs. Okay. So night blindness. In night blindness, what will happen? There is a difficulty in seeing in low light, like night, mostly night. Okay. So what you have to do? We have to increase the intake of vitamin A rich foods. Okay. Along with vitamin A, you have to take balanced diet. This is the important treatment. Okay. And in the Bitot spots, what happened? This is also severe A deficiency. Okay. Along with conjunctivitis, they have conjunctiva. Okay. Near the cornea, what have you have? Foamy patches, white foamy patches. So means that is vitamin A deficiency. So here you need to take vitamin A rich foods. Sometimes you need supplements also because it is a severe deficiency. That's the reason. And xerophthalmia, it is a prolonged vitamin A deficiency. So here what happened? Your eyes become very dry, redness, inflammation of the conjunctiva, dryness, redness, and inflammation of conjunctiva. So this time you need medical intervention to treat the symptoms. Along with you need to improve vitamin A intake. Okay, you need to sometimes you need to take vitamin A supplements also. Next, keratomalacia. Keratomalacia is also severe and prolonged vitamin A deficiency. So what happened in that? You will get ulcer on the cornea and you will have vision loss. So this is a urgent medical attention. Sometimes need surgery. So along with you have to take consistently, you have to take vitamin A rich food. More large amount of vitamin A rich food you have to take. Okay, this is the important thing. So, so what you have to do, you have to examine, test the vitamin A, how much amount is there. You have to increase according to RDA, which disease is that. According to that, you have to advise the person and educate the person according to their requirement. You need to take that. So these are the vitamin A deficiency diseases, and what you have to do, you have to improve vitamin A. Now, vitamin B deficiency diseases. One is beriberi. Berry berry. Second one is pellagra. Third one is Arbi, Aribo, Ariboflavinosis. Ariboflavinosis. Next, fourth one is neural tube defects. Neural tube defects. And fifth one is megaloblastic anemia. Megaloblastic anemia. These are the deficiency of vitamin B. Vitamin B. What you have to? Vitamin B deficiency, mostly B1. B1 intake is decreased. Very, very. So what the symptoms you will get? Fatigue, weakness, swelling of the lower legs, difficulty in walking, rapid heartbeat. So now what we have to take? We have to take sometimes thiamine rich food and balanced diet, sometimes supplementary needed. Okay. And in plagra is due to the vitamin B3 deficiency. Mhm. Niacin. Okay. What will happen? Dermatitis, inflammation of the skin, diarrhea, loose motion, dementia, loss of memory gradually. Okay. Mucous membrane inflammation. Okay. These are the symptoms of plagra. What you have to do? You have to increase the niacin rich food diet. Okay. And along with you have to take supplementation. Next is ariboflavinosis. It is the deficiency of vitamin B2. Okay. What happened? Cracked lips, sore throat, inflammation of the mouth and tongue, skin disorders. So you need to take riboflavin supplements and rich amount of riboflavins, B2. Next is neural tube defect. It is the deficiency of vitamin B9. Very important. It is the malformation of brain, spinal cord, and both in the fetus. Very severe condition. What you need to improve the increase of vitamin B deficiency and during pregnancy and need a medical treatment also. Next is megaloblastic anemia, deficiency of vitamin B12. What happened? Fatigue, weakness, shortness of breath, pale skin. So you need to take vitamin B12 supplements and rich diet. Okay, these are the diseases. So at that time, you need to take vitamin B complex remedies. Vitamin B complex rich diet food. Next is vitamin C deficiency. Vitamin C deficiency, one is scurvy. Second is infantile scurvy. Third is hypovitaminosis C and scorbutic rosary. And fifth one is gingivitis, inflammation of gums. First is scurvy. Scurvy is the deficiency of vitamin C. What happened? Fatigue, weakness, swallowed and bleeding gums, joint pain, poor wound healing. So wound healing will delay. So you have to take vitamin C uh, supplements or rich diet. In infantile scurvy, it is for infantile. They have irritability. They are unable to eat the food, swallow in painful joints, failure to thrive. Okay, so here also you need to give vitamin C supplements. Okay, and mother also need to take vitamin C. Hypovitaminosis C, decrease vitamin C deficiency or chronic deficiency of vitamin C means here fatigue, weakness, increased susceptibility to infections, slow wound healing. Okay, So you need to take vitamin C complete means here all the healing purpose is very slow in vitamin C deficiency. So you need to take vitamin C rich diet. Carbic rosary, vitamin C deficiency, and here your abnormal growth of costochondral junction. So especially this happen in vitamin in children. You need to treat vitamin C deficiency. Okay. Next we have gingivitis. It is also very severe deficiency of vitamin C. Gum tissues having swelling, pain, tenderness. Again, you have to do vitamin C treatment. Okay. So these are the disorders of vitamin C. So we have other different types of vitamin D, iodine also. So we'll discuss in next class. Okay. So any doubts, kindly ask.